This short video will introduce you to the new communication resources on ITU and how you can use them to support your patient to communicate. About a third of patients on ITU will have difficulties communicating. Communication difficulties can be caused by various things: a primary medical condition such as a brain injury or stroke, or it may be due to an ITU intervention itself, e.g. an endotracheal tube or cuff trachea, sedation, critical care weakness or delirium. Other things like pre-existing mental health or learning difficulties, visual and hearing impairments, or a language barrier may also impact on a patient's communication with staff. Research has shown that ITU patients with communication difficulties report feelings of frustration, powerlessness and anger, and are at an increased risk of developing post-traumatic stress disorder. Similarly, nurses have also reported feelings of powerlessness and frustration when caring for this patient group. GPIC's guidance states that patients must be given help to communicate and must be effectively communicated with. There are also national competency frameworks for both nurses and AHPs working in critical care that specifically outline addressing the communication needs of patients. Since COVID, the resources in ITU, things like whiteboards and charts, have significantly diminished and many are no longer appropriate. We are launching some new low-tech resources and a simple flowchart that will help you to choose and use the right communication tool for the right patient. All the resources are housed in the delirium trolley outside room 11. Work through the flowchart on the top of the trolley to help you decide what to try first. Step 1. This is just a reminder about some simple things that can make a big difference, such as checking glasses or hearing aids. Step 2. Use the flowchart to consider A, your patient's cognitive and language status, and B, your patient's upper limb function. Then go to the numbered and coloured drawer to find appropriate resources. For instance, if your patient has good cognition and language and good upper limb function, go to drawer 1. Here you'll find whiteboards and pens, boogie boards, and an information sheet about free apps that patients and their families can download onto their own devices. If your patient has good cognition but poor upper limb function that makes writing difficult, go to drawer 2. Here there are picture and phrase charts to point to and a partner-assisted alphabet chart. You can scan the QR code here to watch a short video about using partner-assisted scanning. If your patient has poor cognition but good upper limb function, go to drawer 3 to find a yes-no chart and simple picture chart. If your patient has poor cognition and poor upper limb function, then picture charts and whiteboards will not be suitable. Go to drawer 4 to find some helpful tips on supporting communication and consider completing a This Is Me profile. Lastly, step 3, refer to SALT on dashboard. We can chat to you about what has worked so far and offer any specialist advice and support. The therapy assistants and SLTs will be ensuring the trolley is kept stocked. Please return any resources to the trolley so we can clean them and put them back in the drawers. If you have any questions or feedback, you can speak to an SLT team member or a therapy assistant on ITU. Alternatively, you can email Charlotte at this address. Thanks for watching.